I be the bridge. You're finally going to get to meet someone in person that is actually in the book. But I'm here with Dr. Debbie Stevens. And if you're a longtime listener of the podcast, and if you've been following me for many years, you know that Debbie is actually one of my best friends, and some of her experience as a healthcare professional is also covered in the book. And so, I'm grateful to have you here, not just as a friend, but as a mental health professional, especially in the culture that we're in now. I would love for you just to share a little bit about why you chose this field and why it's important to you. And then we can just dive in.
Okay. Well, first of all, I want to say thank you for this opportunity. Although we have a 30-year span of friendship, I still have been a huge fan of your work and greatly admire the work that Be the Bridge is doing. And I feel like there's a lot of alignment between the work that you're doing in this space and mental health advocacy. So I'm thankful for this opportunity. But I've been passionate about mental health going all the way back to undergrad experiences and being able to connect with people in their most vulnerable times of their lives and when they're either in acute crisis or in states of despair and depression or a lot of fear and panic, and being able to partner with them during those most vulnerable times. I feel like the unique way that God has shaped me and given me a heart for people, I've been able to be used and served, and I serve in a way that I see people's lives restored. And so it's just been a very rewarding career for me. And I've done a lot of different things over the years, but just been very grateful for the opportunity to serve his people.
Right. And we're here in Atlanta, and I know one of the things that you're passionate about is just this space of dealing with BIPOC patients who have unique experiences. And I know some of that you've incorporated because you're now on the Mayor's Council.
Oh, yeah.
And so what kind of, and I know this is something that you are, being on that board, that you are making recommendations, but what kind of unique challenges do you feel that Black, Indigenous people of color face, within the space of mental health?
Yeah, I'm glad you mentioned that because I feel like right now we're in a very tumultuous time politically. All the things that we've gone through in our communities, racially, and then you look at the pandemic. So even just, across the globe, people are more stressed. Yeah. But yes, we as BIPOC communities and people groups, we have experienced unique stressors on top of everything that everyone on the planet is going through, right? Because of the historical injustices that we've experienced with oppression and legalized segregation and ongoing discrimination. There is this invisible kind of load that we carry of just being people of color in the world that sometimes people don't see. So it's, recognizing, okay, are people mistreating me because of who I am and what I look like, and how do I navigate that? And that spans from the least fortunate, because when I was working at Mercy Care, which is a federally qualified healthcare center, so we're serving people who are unsheltered, unhoused, all the way into private practice spaces where I'm working with attorneys and medical professionals and academic, professionals who are also in spaces where they may be the only one. So now they're experiencing, mistreatment or different microaggressions, and they're questioning, okay, how do I navigate this space? So I think sometimes it could be dealing with social injustices, in a broad span, all the way down to individual experiences on a one-to-one basis that people are trying to navigate. And a lot of times people in the majority community, they don't think about those things.
Right. And so as a professional, you have to kind of tailor your care to deal with those unique needs, right?
Yeah. So I, because of that, what I was calling that invisible load of just being a person of color, and then you may come from a culture that really prioritizes family, and faith, and so they may not lean into professional help and support. And so you have to start breaking down a lot of the stigma or even lack of knowledge.
Right.
So it takes a lot for people to get in front of me.
Right.
So that's why working on the Mayor's Advisory Council is really important work, because there's a need for awareness so that we can address stigma, so people can realize it is okay to ask for help.
Right.
And this is when I know I need help.
Yeah.
But a lot of that is still being disseminated into the community.
Yeah. It's not just going to pray away, I saw a shirt. I think it's like, it says like prayer and therapy, or I forget what it was, but it's
like prayer works and therapy does too.
Something
my
like
medication
that.
works too.
And I think that's important, especially in a lot of the spaces when you're talking about BIPOC, that it goes hand in hand.
Absolutely.
And I think you have an experience in both. You're able to merge that faith part along with the scientific part and practices, and show people how it goes hand in hand.
Tasha, that's one of the things I don't say I pride myself, but I have recognized that this is something that has made me a unique provider. Because a lot of times when people are seeking out someone who is culturally competent, sometimes they approach me apologetically, like, I'm sorry to say this, but I wanted a Black woman. I'm like, girl, you ain't got to apologize for that. I want one too. You know what I'm saying? Because people want to be seen. They want to be heard. They don't want to explain. Like, I'm feeling like maybe this could be because of my race. They want someone to be like, have you considered this could be because of who you are and what you look like. And so I think that when you understand intimately and personally what the culture is like, so this is why you didn't feel safe to talk about this with your parents or in your community. Oh, this is the reason why they told you to pray, and they didn't want to take you to therapy. They didn't want to get you diagnosed for ADHD. They just, whoop you until your grades improve. So it's like acknowledging some of that disconnect and I would say isolation, but some of the we just lack that knowledge. We didn't have access, and so I think when you understand the community, you understand the values, and then you bring in, but this is what we've learned through research. This is 20 years of experience of working with people like you. This is what I've learned. This is my clinical expertise, and to blend that. But then do it in a way where they're like, okay, girl, we can be friends and we want in this space. That makes people feel really validated.
Because you have a way of, you're able to connect because of your cultural knowledge, your cultural intelligence, and your experience.
Exactly.
And so that's so good. How does historical generational trauma, because you think about where we are now, and I even think about like some of the things my mom is experiencing right now with the culture that we're in today, where history, different things are being rolled back, and I know it is very triggering for a lot of the baby boomer generation, and then even some of the maybe Gen X people. How does your how do you think historical generational trauma show up in your practice, like when you're dealing with that? And I know, especially people from our baby boomer generation who marched and who sat at lunch tables, who many of them have been spit on, beat up, all of the things, and they see this reversal. What kind of healing strategies or things that you feel that could be effective even for where we are right now?
Yeah, I think that's an excellent point, because the generation before us, like our parents' generation, growing up in the 60s and 70s, they were like alive and well during the civil rights movement. And so they may have experienced just up front, racism in your face, being called certain names and mistreated. And that becomes part of their understanding of the world, their understanding of the country, their understanding of politics. And so they have said things and done things to their children and said things to their children that help form, certain belief systems. And so sometimes it shows up as anger. It can show up as anxiety.
Yeah.
It can show up as irritability, where sometimes people may have a prolonged negative perspective. You know, it can show up as hypervigilance, you know, because it can be a trauma response to, you're always kind of looking and detecting a threat. You're looking for someone to maybe mistreat you or you know, treat you differently. So I think that a lot of, and because we know that historical trauma isn't just being called the N-word, but it's been denied access to the knowledge and the resources needed to have, you know, healthy perspective about mental wellness. So a lot of times it shows up as stigma, mistrust, you know, that they don't understand what is it that you do. Because of, we remember the Tuskegee experiment. We know about, you know, how we've been betrayed by medical and research scientific communities. And so I think partly this, one of the strategies for me is to name it, to say, hey, this is what we've gone through, and these are the ways that we've been traumatized as a people, as a collective. And a lot of times providing space for people just to share their experiences. And then I'm almost like remember the when you were little and you had to connect the dots to make a picture, like 1 to 2 to 3 to, and so sometimes for me I feel like I'm connecting the dots and helping people to see, okay, is it possible that you've had these failed marriages because you know your, you know, lack of trust, because what you've seen your mother had to go through, because what her parents had to go through. And so a lot of times people, when they feel seen and they feel heard, and they don't feel alone, so it allows them to feel numbered, you know, with others, and that collective experience can provide healing and recovery.
That's so good. I think, you know, sitting here listening, these are really good things to think about now. So I think we have to have a lot of patience with each other right now. And I think also when I think about our community, it's like the Black church has been like a safe place, you know, for many people. But now, you know, when we see things happening within the church as a whole, that doesn't even seem like a safe place. There's there's this mistrust because of how religion has been used. And so I think it's important, like you were saying, to remember to connect those dots on why someone may be responding a way to, like, even spiritual leadership, you know, because of their past trauma and the current trauma that's happening with so much like unhealthy theology and different things like that. So that's important. I'm just thinking about that as you're talking, why some people are having like just the resistance, you know, that they may be having, you know, within our culture. What are some encouraging tips as we close? What are some encouraging tips you can offer to bridge builders as we're talking about mental health in this day and age, you know, with everything we have coming at us? I mean, like, it seems like the whole world is on fire.
It does.
It seems like the whole world is on fire. So what are some things, you know, I know it's like, you know, breathing techniques help, like all of those things.
I say do all the things.
What are some things?
I would say to your audience, people who follow your work and maybe listening to this podcast, that you know, I see you. You are seen, and while you are holding space and doing this work and carrying your own pain, you're not alone, you know, and I want to encourage you to give yourself permission to find rest, to get your own support, and, you know, whatever you need to cultivate healing for yourself so that you can keep doing the work, because we need you. Because not everyone is called to do this specific work in this specific way. And so if God's touched your heart to be interested in racial reconciliation, racial unity, we need you. And I want you to know that peace is not just in this huge experience and that, you know, in a church service. God can meet you in very small, sacred ways. You know, we're finding ways to cultivate joy. Like you see women doing jump rope, game nights, coloring. There's all kind of ways to kind of cultivate joy in your life. So I would say find that rhythm of activism and rest, like being doing resistance work, but then also renewal. Just find that rhythm. Lean into it when you have the strength, but then also get that replenishment when you need it to.
Yeah, I love it. I think one of the things you said, like people, there's a need to be seen and to be known. Yeah. And I think as a African American, a lot of times you can feel invisible, and especially when there's actual erasure happening, like you don't matter. And we've seen that throughout generations, and there's this Swahili word when they greet each other, instead of like how we say hello, they say sabonya, and it means sabonya, and it actually means, it doesn't mean like hello, like, but there's their language is deeper in its expression, and it means you are seen. Yes. So it's like the greeting is giving acknowledgement to your existence. Yes. And I was like, we need some Swahili. We need to start saying Saboya every time we greet each other. Yes, we need some Swahili words to express our human experience. Yes. And there's this reply, this like, I may pronounce it wrong, but it's like Sikanu, and it means then I am here. Whew, I got chills. And it's so powerful, like you are seen, and it's like you're caring. Yeah, it's like a validation. Yes, it's like validating who you are in this space, and that is a huge part of healing and recovery. Yes. So part of our resistance is we need to learn Swahili. We need to learn some Swahili, girl. I love it. Well, thank you so much. Dr. Debbie, for just always lending your expertise, for all the work that you do, and for how you really truly see people. I've gotten to see you in action on calls with people, and you humanize people, and you do make people feel like they are seen no matter what their background experience. I wouldn't know when you're talking to someone, I wouldn't know if you're talking to someone that's a CEO of an organization or someone that's living their houses on the street. Exactly. And you humanize people, and I think we can learn a lot for that. So I love you, and I appreciate you. Thank you so much. Thank you so much for joining us on the Be the Bridge podcast. My pleasure.